Welcome to the Thursday edition of Video Clips and the final installment in this very long series on Anatomy of an Epidemic by Robert Whittaker. So this is the final chapter here. And I'm going to talk about how the whole regulatory scheme went wrong. Prozac was really the beginning of this whole biological model. That's when it really took off. And Eli Lilly had problems with Prozac from the beginning. The drug caused aggressiveness in animals, the same behavior with no accompanying improvement in depressive patients. So there were decisions made to use other drugs to control the agitation, and the agitation decreased, but the drug worked no better. The drug wasn't approved. Prozac was not approved in Germany, and in order to get the drug approved in the United States, researchers were instructed to report adverse events as actual symptoms of depression. After approval, patients taking Prozac committed horrible crimes. Some killed themselves. They estimate 39,000 adverse events were reported during one 9-year period, and the FDA estimates that only about 1% of adverse events that take place are actually reported, which, if you translate that, means about 4 million Americans were harmed or killed during that 9-year period of time. That's pretty striking when you think about it. The story told in the psychiatric journals was very different. Lilly said that the drug was safe, effective, addressed the cause of depression, serotonin deficiency. And this completely ignored what the National Institute of Mental Health had said at one point in time when they were a little bit more objective about this, that elevations or decreases in serotonin levels had really nothing to do with depression. And I covered in an earlier video clip the fact that the research had been terrible in terms of identifying serotonin deficiencies or excesses as anything to do with depression. Public perception remained a problem, and surveys showed that only 12% of Americans were receptive at one point in time to taking pills to treat depression. We've come a long way from there because I think most depressed people expect to get pills for depression. So in response to the public perception problem, the National Institute of Mental Health became very aggressive in promoting the idea that depression was a disease that required treatment. They lied about the results of clinical trials, and the strategy worked. And by 1990, 650,000 prescriptions a month were being written for Prozac alone. And the drug was promoted, and I've used this term before, as being like insulin for diabetics. It was necessary and life-saving. Other drugs followed the same pattern. Xanax, Risperdal, I could list the whole group here. Skewed and fraudulent studies, outright lies, misrepresentations, and marketing campaigns that the government actively participated in. In other words, and Whittaker says this directly in his book, the psychiatric profession has been lying to the public for decades. There is no biological basis for mental illness and no studies to support the use of medications to treat these imaginary conditions. Anyone who dissented from the party line was punished. Peter Breggin and Lauren Mosher were rising stars at the National Institute of Mental Health until they started questioning this whole thing. Peter Breggin went on the Oprah Winfrey Show, was very outspoken about it, and in response, the American psychiatric profession filed a complaint and tried to have his medical license taken away. And by the way, he's going to be with us for our fall conference, and I'm reading his books right now, his new books, which are amazing. So you'll get a chance to talk to him and listen to what he has to say at our fall conference when you're with us then. This has happened to other people, by the way. Breggin and Mosher weren't the only people. Job offers have been rescinded. Funding was yanked. Anybody who spoke out against these drugs, including drugs for attention deficit disorder, was punished. One doctor who spoke out about the overdiagnosis of attention deficit had her computers seized, her research funds cut off, and she was charged with misconduct. Dr. David Healy says, and this quote is interesting, "The thought control aspect of things in psychiatry today is like the old-style Eastern European social control. Back to the Soviets using neuroleptics to cause people to recant their stance against communism. My gosh." Well, it only continues because the psychiatric profession allows it to continue. And what adds to the mix is the National Institute of Mental Health, medical schools relying on grants, drug companies distributing patently false information to the public through newspapers and reporters who don't know the right questions to ask, and medical textbooks for psychiatric students are sanitized of any evidence of these discussions that I've been having with you for the past few weeks. So anyway, the bottom line is the business model for these drugs is pretty ingenious. There's no chemical imbalance for the drugs to cure, but they cause chemical imbalances that turn first-time customers into long-term addicts. And this is my take on it. This didn't come from Whittaker's book. But the psychiatric profession is really no better than the neighborhood crack dealer who knows that once people try his product, they'll want and need more. Not only are people unable to stop taking the first drug they're prescribed, but they almost all need more drugs in the long term to address the side effects, both physical and mental. Eli Lilly, for example, knew that the side effects with Prozac were an issue and developed Zyprexa to treat them. Drug reps were told to tell doctors that Zyprexa is a great mood stabilizer, especially for patients whose symptoms are aggravated by an SSRI. Whittaker states that Eli Lilly's reps were actually instructing doctors how to use the second drug to treat the symptoms brought about by the first one. Another drug company admits in its own ads, and you've seen these on television, that the drugs don't work. Bristol Myers Squibb markets Abilify with the message that 2 out of 3 people treated for depression still have symptoms, and Abilify taken with those drugs can help. What does that say? Psychiatrists were making money just like real doctors, and so were those who ran the drug companies, and that's what's really escalated all this to the place that it is right now. Executives at Eli Lilly made $3.1 billion on their stock options, while Prozac and Zyprexa rose in sales. Psychiatrists were being rewarded by the drug companies. In fact, they're the sales force for the drug companies. Ethics were completely ignored. An investigation by Senator Charles Grassley showed that most psychiatrists were deliberately hiding the fees they were paid from the schools they worked for. He also discovered that psychiatrists were reporting outcomes that were completely false. The drugs benefited no one in the long term and caused worsening health for most patients. But the public has been told, of course, by the drug companies and the psychiatrists that they're effective. So, solutions, and I'll just kind of tell you where I ended up after reading this book and all the time that I've spent on this issue. There's little justification for the use of these drugs for anybody, but some professionals think that limited use may be appropriate. But history has shown that most patients will get better on their own, and one way is to use medications judiciously and watch and wait. Those who get better on their own won't need meds, and some who don't might benefit. And there are some places in the world where this type of approach is used. And so I kind of take the hard stance, we maybe should never prescribe these drugs. And of course, the psychiatric profession takes the stance that everybody should take these drugs. And there are some places that are a little closer to not quite where I am, but a little closer to the middle. In one facility in Finland, for example, first episode patients are not treated with drugs. And the studies show that 79% of these patients have no symptoms, 80% are working in school or looking for work, and only 20% end up on government disability. 2/3 of them are never given drugs, and only 20% take them regularly. Since the program began in 1992, this is quite some time ago, not one first episode patient has been chronically hospitalized, and spending on mental health has dropped 33%. Schizophrenia is disappearing from this area. In the UK, exercise has proven to be the best way to treat depression, and physicians actually write prescriptions for it. This is supported by studies from Duke University that show that exercise alone was better than treatment with Zoloft, and that exercise combined with Zoloft didn't produce results because the Zoloft negated the effects of the exercise. So the bottom line is that there is a solution, and unfortunately in the United States we sometimes don't learn from experience, even other people's valuable experience, but I think Finland might be a model that we could do well to emulate, and we could start taking people off the disability rolls for mental illness in this country instead of putting more people on. Unfortunately, the profession's not likely to admit that it's wrong, and the drug companies want to keep the deception alive. It results in billions of dollars of sales annually. The only hope is for independent public education that causes patients to make different choices, and that's really what I'm all about. That's one of the reasons why, at great risk to myself and my company, I've chosen to have the Wellness Forum focus on this issue, even though it really aggravates a lot of people. And it's why Peter Breggin is coming to speak at our conference to talk about his objections as a psychiatrist to this model of care and to present the evidence against it, and why I am spending all of this time on these video clips on this particular issue. It's imperative. It's hurting just as many people as traditional cardiology and endocrinology are hurting people with heart disease and diabetes, and something must be done about it. So next week we'll move on to some different programming. I think I've spent enough time on this issue for now, but hopefully a lot of you will get a chance to hear Dr. Breggin talk in November, because I think it will be very enlightening, and we're going to continue to make this front and center in terms of the programs we offer. As always, pass this on to anybody who you think might benefit, and I'll be back next week for the Tuesday video clips. Have a great day.